With us today, we have Janice Carroll, which I had formerly worked with at the City of Markham, so it's always a pleasure to have her here. And joining Janice is Brian and Mahesh, both from Toronto Public Health, managers and extremely versed in the public health side of things. So I'll keep it short and sweet. I will throw it over to Mahesh, or I apologize. Before Mahesh, I will just quickly go over what our agenda looks like today. So we will do an overview of what these amendments look like, very surface level stuff. Mahesh and Brian will then speak to a little bit of what that enforcement and compliance looks like. We will then look at what the implementation looks like, and Janice will take over with her knowledge on the facility level. And then we will open up the floor with some Q&As. I'm sure there might be a whole bunch. We ourselves are still versing ourselves with the regulations and what these amendments look like. So that being said, I will throw it over to Mahesh. Take it away.
Thank you, Nico. First of all, I would like to thank Lifesaving Society for inviting us to this very important information session. And thank you all for contributing to public health in the work you do. So I hope you'll find this useful. And without any further ado, I'll continue. So we are going to be talking about a few things this afternoon. I'll start off with some general comments about the regulation, and then we'll talk about all these new categories of pools. Some are modified existing categories that the province has made some changes to. Next slide. So what they have done is they've added these new categories, as you saw in the previous slide, and specific requirements are listed in the regulation. For example, public cold plunge pools, FAC or free available chlorine residual equals to minimum of 5 ppm and not more than 10. However, the general requirements that apply to all pools are not listed. However, they are applicable to all the classified pools. So for example, Class B pool requires records to be kept, and that applies to cold plunge or any of the other categories. Exemptions are explicitly stated, and they apply. For example, regulation as amended, section 7.8 sub C excludes public flotation pools and cold plunge pools from requirements of this section. Next slide. So here is a graphic of the new pools classified under Class B. So there are 3 that are fixed. Basically, it's as you can see, flotation pools, public cold plunge, Class B, hot water pool, and the fourth one is rowing club pools, and that is a pool depending on the action of the people in that rowing club. If they jump into the water for any reason other than, when you're rowing, accidents can happen, or people flip the canoe or whatever they're doing, that is different. But if you use that pool for swimming, then it becomes part of the regulation, and regulation applies to that. Next slide. So Class C has been expanded too. As we had wading pools, splash pads, and spray pads, which are still there, but flotation tanks have been added to Class C. Okay, so next slide, Brian.
Yeah, thank you, Mahesh. And good afternoon, everyone. My name is Brian Zhao. I'm one of the managers with Toronto Public Health. I've been around for about 17 years. I will kick things off with modified pools, and just to get the easy one out of the way. So for the modified pool, there is a slight change in the definition, the removing depression in earth from the previous definition. So now it reads that it's a public pool that has a basin-shaped floor sloping downward and inward towards the interior from the rim. Okay, next, please. So I just wanted to stay on this slide for just a quick second. As many of you may know, that Toronto public health inspectors conduct routine inspections and complaint or outbreak-based investigations for recreational water facilities. And those include Class A, Class B swimming pools, spas, splash pads, and wading pools. Now, with the introduction of cold plunge pools, hot water pools, flotation tank, flotation pools, there is now a lot more content in the regulation. So on the back end, Toronto Public Health is focusing on training with internal and external partners, and providing clarity on a number of different topics, organizing internal forms, data systems, while at the same time waiting on the province on a number of enforcement items and seeking clarification with the province on a number of different other issues. So that's a lot of words. What does it all mean? So it means that currently Toronto Public Health is at the phase of notifying existing facility owners that their premises is now covered by the regulation. And health inspectors will provide education to the best of their abilities to the operator and owner on regulatory requirements of these facilities. So basically notification and education. Since a number of the issues are not clarified by the province, Toronto Public Health is currently not actively inspecting the existing premises, and also there's no active enforcement for the existing cold plunge, hot water pools, flotation tanks, flotation pools in Toronto. Now, that being said, if a complaint is registered with public health and a health hazard is identified associated with these facilities, enforcement action can still be taken to eliminate the health hazard. So that would be enforced under the Health Protection Promotion Act, not under the Regulation 565. Okay, next, please. Thank you. So let's dive into the new contents a little bit more. So first up is the cold plunge pools. The public cold plunge pools, they've been a hot topic of discussion for Toronto Public Health for a number of years. They have been popping up here and there. We've had operators calling in and emailing us and inquire about them. And we've always had a hard time supporting because of the lack of regulation and just information overall. So as of January 1st of this year, Regulation 565 introduced a requirement for public cold plunge pools. So the definition is that it is a public pool that is maintained at 15 degrees Celsius or less, with or without hydrojets, that is not drained, cleaned, sanitized, and refilled before the use by each individual. The water quality requirement for free available chlorine is between 5 to 10 ppm, and the safety requirement is that it's a non-slip deck surface, handrail, clock, and health warning signs. So please keep in mind that the regulation is not very clear, and like Mahesh mentioned previously, that in addition to these safety requirements, because public cold plunge pool falls under Class B, all the other safety equipment that's applicable to Class B pools will also be applicable to cold plunge pools, such as emergency phones, first aid kit, reaching pole, throwing aids, and black discs. Next, please. So there is a requirement for the health warning sign, and this is a brand new sign for cold plunge pool. So it reads that Children under the age of 12 is not allowed in the cold plunge pool unless they're supervised by someone who's 16 years or older. The use of cold plunge pool may trigger a cold shock response. So people with health or medical conditions, they should talk to their doctor before using the cold plunge pool. Be careful going in and out of the pool to prevent slipping. Don't play or swim near the drains or suction outlets, and any body part, hair, jewelry can become trapped and cause injury or drowning. And lastly, don't enter or remain in a cold plunge pool if the bather notices that the drain cover is missing or loose, and make sure that it gets reported to an operator. So the next addition to the Regulation 565 is hot water pool. The hot water pool is, if you read the regulation, it's not clearly described under the definition section of the regulation, but it is defined under section 21.1 as a pool with water temperature of greater than 35 degrees Celsius. Now, because it requires a upper limit cutoff switch, limiting it at 40 degrees Celsius, we can understand that a hot water pool operates between 35 degrees Celsius to 40 degrees Celsius. Now, the water quality for the sanitizer for free available chlorine or bromine is required to remain between 5 to 10 ppm. And it also requires a health warning sign at the entrance of the hot water pool, which I will get into in the next slide. And section 7, subsection 11 requires all the operator of a public pool or spa to test and record each day. So it's applicable to the hot water pool as well, that minimum 30 minutes before opening. So that covers total alkalinity, the pH, FAC or bromine, water clarity, as well as water temperature. Now, keep in mind that the water temperature is required for both the hot water pool as well as for spa. Section 21 covers the requirements of upper limit cutoff switch for hot water pools. So similar to spas, the maximum temperature, like I said, is 40 degrees Celsius. A clock is required for hot water pool, but unlike spas, there is no requirement for emergency stop button, a timing device, or audio visual for hot water pools. Section 19 requires the signage for the hot water pool to be posted at the entrance. So this is the sign, similar to the cold plunge. This is a brand new sign. Children under the age of 12 not allowed unless they're supervised by someone who's 16 years or older. Pregnant women or anybody with known health conditions, they should consult with the doctor before entering a hot water pool. Don't play or swim near the drain or suction outlet. Your body overexposure may cause fainting. 10 to 15 minutes is suggested, or it could be excessive to anybody. So make sure to cool down periodically and leave the hot water pool if nausea or dizziness occurs. And lastly, entering or exit the hot water pool slowly to prevent slipping. So moving on to the public flotation tank, aka sensory deprivation tank, aka isolation pods. It comes with a variety of different names. So similar to cold plunge, these flotation tanks also, they've been around for quite a while, and they come in all shapes and sizes. The updated regulation defines a public flotation tank as a public pool that contains saturated bathing solution of magnesium sulfate, also known as Epsom salt, that is not drained, cleaned, sanitized, and filled before each use by each individual. That's designed for use up to 2 bathers. So there is a size limitation, and later on I'll go over that any of the similar tanks that fits more than 2 people would be considered as a public flotation pool instead of public flotation tank. It provides a light and sound reduced environment. So specifically the public flotation tanks, it falls under the Class C facility. It has a number of filtration and disinfection and safety requirements, which is covered in the next slide. So next one, please. Subsection 26.0.2 is a big section, which covers emergency equipment and disinfectant. The public flotation tanks are required to have first aid kit, device for emergency communication, emergency equipment appropriate for use in flotation tank. As for the water chemistry, the total alkalinity is required to be between 80 to 120, pH between 7.2 to 7.8, free available chlorine, if used, is to remain between 1.5 to 5 ppm, or if bromine is used, then it shall remain between 2.5 to 5 ppm. And water temperature cannot exceed 37 degrees Celsius. As for records, the daily record that's required is 30 minutes before opening and either prior to each new bather or every 4 hours. Now, in terms of water filtration, it is required that the system to have the capability to turn off the water in the tank at least 3 times between each bather. Shower facility is required. Now, what's interesting is that alternative filtration methods or water disinfection is open for review at the moment by the public health inspector or by the medical officer of health. Next one, perfect. So similar to public flotation tank, the public flotation pool is defined as contains a saturated bathing solution of magnesium sulfate for flotation purposes. That's not drained, cleaned, sanitized, and refilled before use by each individual, and is designed for multiple persons. So like I mentioned before, that flotation tank is designed up to 2 people, and pool is more than 2 people. Free available chlorine between 5 to 10, pH 7.2 to 7.8, total alkalinity 60 to 180 parts per billion. The major difference, in addition to more people, is that the flotation pool is also required to have an appropriate size secondary treatment of UV light. And also it must have an automatic shutoff device and an audible and visual alarm in case of system failure. So we are still exploring and looking into a lot of these just because the regulation is quite high level. So the specifics for each flotation pool may be different in terms of sort of the size of the UV light. Public flotation pool falls under Class B pools. Okay, I'm going to take a break over here and hand this back to Mahesh to go over the public pools and public spas. Back to you.
Thank you, Brian. So public pools, they have made some changes to it. So under the operations section, they have changed the definition of a black disc. And it says a black disc 150 millimeters in diameter on a white background is permanently fixed to the bottom of the pool at the deepest point. Permanently fixed means that if you have a main drain as a black disc, that is not permanently fixed. So that's the change. Water quality requirements. So FAC range has been extended 0.05 to not more than 10 ppm, and bromine 2 ppm to 8 ppm. Notices and markings now can be shared, notices can be shared between two pools that are in close proximity to each other, as in section 19.1.1. And similarly, safety equipment for pools that operate in immediate vicinity of a public spa or a second pool, the owner of operator of the second pool or spa is not required to provide duplicate items of emergency equipment and phone. Next. So public spas, this requirement, basically what they've done is exempted two types of spa. First is the hotel spa that a spa that is in our room that has been exempted from the requirements as long as appropriate signs are posted. And same with the hotel spa, that hotel that has fewer than 6 dwellings units or suites. As long as the sign is posted, it is exempted. Sorry.
Obviously, I appreciate our help, and I appreciate anyone's help that's obviously willing to spend the night without whatever. So, like,
if
you
we
want
can
to
get
tell them,
everyone
I'll take a
to
time.
please. Thank you.
Okay, next slide.
Yep.
So this is the sign, and the letter markings would be as shown here in the arrow, and the basically caution sign needs to be posted on both types of spas. Next. Okay, and like the other sign, caution sign, includes all these items, and it must be also in letter size as described in this box. Children under 12 are not allowed in the spa unless supervised by a person who is 16 years or older. Pregnant woman and person with known health or medical condition should consult a physician before using a spa. It's pretty similar sign to the one that you saw earlier. The next thing is do not use the spa if you have open sores or rashes or experience nausea, vomiting, and diarrhea. This is an obvious reason. Overexposure greater than 10 to 15 minutes can create fainting and may be excessive for some individuals. Cool down periods and leave the spa if nauseous or feeling dizziness. Enter and exit the spa carefully because you can slip. And then the other part is, as in previous slides, do not play or swim near a main drain for obvious reasons. You can get caught up and be entrapped, and do not remain in a spa if you see a main drain or suction fitting loose or broken, again, for safety reasons. No food or beverage in the spa. Next slide. Okay, so rowing club, this is the last one, are exempted, as I mentioned earlier, under this section, unless people are using that as a swimming pool, then the regulation applies. Right, so if we walk into a rowing club pool and we find people are using it to swim, then we will use that we will consider that as a pool and expect full compliance with the regulation.
Thank you, Mahesh.
Okay.
I will call on Janice to jump in here and see how we can take all that knowledge and toss it into our own pools. Thanks.
Thank you, Nico. As Nico said, my name is Janice Carroll. I work for the City of Markham as the aquatic lead, but I also sit on the Lifesaving Society Safety Standards Council as the Regulation Review Chair. So thank you all for joining us. I'm going to speak a little bit about implementing the regs at the facility level. So hopefully you are all aware that the Lifesaving Society publishes the Guide to Ontario Public Pool Regulations. The current version is July 2018, which was amended in November of 2024. It helps aquatic facility staff understand and interpret the regulations for public swimming pools and spas. It's in simple language using everyday terms understood by aquatic personnel. All pools should have a copy of the guide on hand for easy reference. It should be available for pool operators, lifeguards, aquatic supervisors, and managers. We're currently working on the new version, and it will be available this year. Until the 2025 version is complete, you can go on to the Lifesaving Society's website and download the January 2025 amendments insert for free on the homepage. So go to lifesavingsociety.com. It's a simple 8-page insert that lists all of the major changes to the regs. All new purchases of the guide come with the insert included. If you already have a guide, just print off the amendments insert and insert it into all of your copies, or use it to make changes directly into your guide. Just write it in. While we had it open to look at the changes to the regulation, we also did a full edit of the guide while we were at it. So even if you have a current version, you may still want to buy the new one as soon as it is available. So first of all, when you're looking at integrating the new regulations into your daily operation, first of all, identify what pools you have that are affected. So as Mahesh and Brian mentioned, you've got pools less than 15 centimeters, hot pools, cold plunge pools, public flotation pools, public flotation tanks. Public pools have some chemical changes. So you want to ensure, after you've identified what pools you have that are affected, ensure that all your staff are trained to ensure compliance. So review all of the materials with your staff, answer any questions that they may have, update any logbooks that you have to make sure you can purchase new ones or change them to make sure that any chemical changes are reflected in your daily record keeping. Some items may not be an issue for you. We know the total alkalinity range has increased. So if you were compliant before, you're going to be compliant now. It just gives you a little bit more wiggle room. So let's look at some challenges that we may have implementing the new regs. So pools that are less than 15 centimeters in depth are exempt from the regs. Some of those examples may be things like fountains at City Hall. So ensure that you've got proper signage at those, such as saying, this is not supervised. If it's known to be used as a wading pool, put safety precautions in place to mitigate risk. So that could include things such as signage, putting barriers up to stop people from using it as a wading pool, or provide supervision. Even though it's not required in the reg, you may want to provide supervision if you know that you've got a pool that is being used as a wading pool and people are swimming in it. We're also going to look at hot pools. So as Brian and Mahesh both mentioned, hot pools are anything that is over 35 degrees Celsius or greater. Some of our common ones that we have had in the past, in addition to the spas, are therapy pools or potentially leisure pools as well. So I'd like to do a little bit more of an in-depth look at hot pools, as this is, where we've been hearing, or where I've been hearing out in the industry that people are struggling with right now. So most of our therapy pools are now classified as hot pools. So common uses of our therapy pools include aquafitness or aquatherapy classes, children's lessons when a pool fouling occurs, adapted aquatics, some of our parent-taught classes. There's that new requirement for signage that you see here. So if you look at that, it states that no children under the age of 12 should be allowed unless they are supervised by somebody over the age of 16. So children under the age of 12 is the bulk of our learn to swim lessons, especially our adapted aquatics program as well. And we know that our instructors can be 15 years of age, so they also don't meet that, they may not meet that supervision requirement of a 16-year-old. The 10 to 15 minutes stating that it may be excessive. If you're running lessons in there or aquafit classes, the majority of those are going to be over 15 minutes in length. So again, that can be problematic in addition to the additional equipment that you need to install the hot water temperature max. So I'd like to look first of all at the definition of a public spa, which again, we went through a little bit earlier, but it states that the definition of a public spa is a hydro massage pool containing an artificial body of water that is intended primarily for therapeutic or recreational use, that is not drained, cleaned, or refilled before use by each individual, and that utilizes hydrojet circulation, air induction bubbles, current flow, or a combination of them over the majority of the pool area. So if your therapy pool or your leisure pool does not have hydrojet circulation, air induction bubbles, current flow, or a combination of them over the majority of the pool area. So majority, there was some discussion on that. Safe to say for sure, a majority is 50% of your wall space. Mahesh even said, in Toronto, they look at more of like a 70%. So if you've got, for sure, if you have less than 50% of your pool wall that is covered with jets or hydrojet circulation, then it's not a spa. And therefore, it's only regulated under the new requirements by temperature only to make it a hot pool and be exempt from the rest of those requirements. So if you've got a therapy pool that you want to use that is not a spa, the Lifesaving Society's recommendation now is for the temperature to be kept between 32 and 34 degrees Celsius and remain less than 35 degrees Celsius at all times. If you do that, then your therapy pool is no longer classified as a hot pool under the regulation, and it may then be used by children and adults participating in our water exercise classes, our learn to swim lessons, or our recreational swims. Now, if you need help with ensuring that you're maximizing the safety in your pools, reach out to the Lifesaving Society. There are a lot of different options that we can offer. The first is comprehensive aquatic safety audits. They are conducted by certified Lifesaving Society safety auditors. The audit team aims to identify potential risks and recommend measures to mitigate them. It's done through a systematic process that encompasses on-site, roughly a 3-hour inspection, review of your operational literature, interviewing with select facility personnel. Then all the findings are compiled into a detailed safety audit report, which includes prioritized recommendations for enhancing safety. A second option is a topical audit. And a topical audit can really be done on anything you want it to be done on. So some common ones that we have looked at in the past are lifeguard placement, safety supervision zones, your emergency procedures, just a review of your staff manual, anything like that, where you just want a quick inspection, audit, guidance, recommendations on making your pools as safe as possible. Safety inspections are also another option. Those are just a facility where it's not looked at your emergency procedures, you're not looking at literature, it's just doing that on-site inspection of facility equipment, all of that. We offer a safety inspection course. You can do that in-house. So you can train your staff to become inspectors. You can inspect your own facility to make sure that they're at compliance. It's very handy to do it prior to a health inspection to make sure that you're going to meet the requirements of the health inspection. If you want to become accredited, so you want that plaque or that sign that you can hang outside of your pool to let the public know that you've been accredited by the Lifesaving Society, then you need to hire an inspector that doesn't work at your facility, just for conflict of interest. So it can be somebody that works at another pool in the area. You can, contact the Lifesaving Society to get a list of safety inspectors that are certified in your area. Then they complete the inspection. If you pass, they give you the form, you fill out the accreditation, you send it in the Life Saving Society, and Mike and Ann make sure that you get a lovely certificate that you can post on your facility. And finally, safety standards are written both at the national level and at the provincial level. And now they're all our provincial ones are available on Life Saving Society's website, that you can download them for free as well. And as always, contact Life Saving Society directly. They are more than happy to help direct your call to the person who can best answer your questions or steer you in the direction to make sure that your facility is as safe as possible.
All right. Thank you. Thank you very much, Janice. That was fantastic. So we've reached our Q&A. I want to again thank all the speakers. Thank you, Janice. Thank you, Mahesh. Thank you, Brian, for all that knowledge. I'll open the floor. I know there were a few questions that came in the chat. I will defer everyone to the chat just so it's, no one's talking over each other and we can address them in the order they come in. So I'll give everyone a moment to type. But if I could get the ball rolling, and this question is directed at Mahesh and Brian, whichever one can kind of answer, but how far in advance does the ministry go to I guess, figure out what these amendments should look like? Like, are they doing consultations with local health units? Are they doing consultations with maybe some other organizations that have their fingers involved? How does it work? How do we get to amendments?
How did we get to the amendments?
Yeah.
Yes. So the categories of the pools that you saw that the ministry has added, in addition to the things that we were seeing in new constructions, there are a lot of new buildings that are being built, especially during the quiet period of the pandemic. A whole bunch of hybrid facilities showed up. And that really causes a big problem. Number one is that we find out when the pool is ready because of a change in planning, building code regulation, that we did not get the plans before the pool was built. So when we get the notice that pool is ready to inspect, we find that it's a hybrid between all the different types of pools, pool, spa, and that together with all the pools that you see in the regulation, that prompted us to raise the issue, us as in health units, represented by ASFIO, which is a body of supervisors, supervisory public health inspectors. We made a recommendation to the province that we need to consider looking at these facilities and applying the appropriate regulation. And that's how it all started.
Thank you very much. Yeah, I remember when they came in, the short turnaround time was December and implementation into January, but I'm sure there's a lot of stuff going on behind the scenes. We do have some questions that I'll turn to the chat to. So our first question is with respect to if there's any, I guess, amendments or comments being made with respect to private or backyard pools. I'm assuming, Sherry, you might be referencing where you're maybe bringing in an instructor or you're, I guess, hosting a birthday party or pool party, and you might have some members of the public joining. Any guidance on those backyard pools? I don't know if that's a bylaw question as well.
So, Brian, you want to do this or you want me to?
Yeah, I can cover this one.
Okay.
Thanks for the question, Sherry. So for the backyard pools in the regulation, it does cover a little bit about that. The private backyard pools, if it's made available for public use, either the owner charge or without charging a fee, as long as they display a signage to indicate that there's specific wording in the regulation basically saying swim at your own risk, and this pool is not covered, it's not meeting the requirement of the Ontario Regulation 565. So as long as they post that sign, then they are exempt from the other requirements of the regulation.
Nico, can I add to that a little bit?
Absolutely.
So even though they're not covered by the regulation or they're exempt from the regulation, I think we also need to be aware of, our affiliates that are teaching learn to swim lessons in the backyard. And even though there may not be a regulatory requirement, there may be an insurance requirement. So, I think we've updated that in our guide to backyard pools, I think, just so that if anyone is using their pools for money-making purposes, or that they're running a business out of it, that they should consult with their insurance provider to make sure that they are covered from a liability standpoint as well.
Nico, may I add to both?
Yeah, absolutely. We're good on time. We're good on time.
So the other thing to keep in mind, and in Toronto, and I'm sure in other municipalities, if it is a pool or a spa in residential area, it may not be zoned as a public pool. I know that in Toronto, our building, our municipal licensing and standard is enforcing this. So that is another thing. If you're making money out of it or you're using it as a public pool, you may be contravening the planning, zoning requirements.
Noted. So in summary, reach out to your local health department or by law. And do consult with, of course, insurance, to Janice's point, and see if it's something that needs to be covered. Next question here. So for Class C public wading pools that are only filled with water when staff are on site, is there any specific signage required, or is it up to municipal discretion? And if I can remind everyone to just mute their mics. Thank you. Who's wants to take on that Class C question?
Sorry, can you repeat that?
Absolutely, yes. So for Class C public wading pools that are only filled with water when staff are on site, is there any specific signage required, or is it up to municipal discretion? So wading pool only being filled and I guess filled for use when there's staff on site.
So, Brian, you can add to this, but the requirements for attendant has been exempted, has been removed now from the regulation. So there is no requirement for staff to be there. However, safety is always number one, and liability is the other issue. If you keep a wading pool unattended, and there is access to it, then there might be a situation where there could be an accident, and that can impact you as the owner of the pool.
Yeah, just to add to Mahesh's point, to Emily's question, that specifically a person or attendant is not required for a wading pool if the water depth is less than 15 centimeters. However, if for this specific scenario, that if the water is only filled when there's a staff on site, then there's no specific signage that's required under the regulation. I don't know if there's a specific sign that you have in mind, Emily, but under the general requirement of the Regulation 565, there's no requirement.
Thank you. Everyone put in your questions. I'm going to go over some of the ones that we answered that Brian, you helped me answer during the presentation, just so we can circulate it out. But we had a question with respect to letter sizing and for the pool signs. And do all the caution signs have the same lettering that's required, or are there specific requirements for each, whether it be between spa and pool or between any one of those new categories?
Yeah, I can cover that. I don't have the reg open in front of me right now, Sherilyn. but from what I recall is that the health warning sign as well as the caution signs, they do have different requirements for the lettering. So I would say just check the reg, and it should be able to provide you with the specific letter heights or the minimum requirements.
Noted. And then a question specific to the black disc. So is that something, or is that a provision that's able to be grandfathered for pool when using a non-permanent one? If the pool was built, prior to these amendments?
No, it hasn't been grandfathered. This is a requirement. Now all black disc have to be permanently affixed. And I think it was done to, this is my opinion though, it was done to alleviate the problem of people using the main drain as a black disc, right? Some pools used to paint the black disc. They would paint the main drain same size and consider it as a black disc that is not permanently affixed.
Noted. I have a follow-up question just out of my own curiosity. I don't know if this is going to open up a can of worms, but for black discs, if they are painted on or tiled on, does the fact that there is grout, or to Mahesh's point, if it's painted on a regular filter which has grates, does that satisfy the provision? Is it a solid black disc, or is it a black disc that's just 6 inches in diameter? Is there any specification whether or not having grout lines or having grates within that would contravene the regulation?
It has to be on a white or light background, and it has to be clearly visible. And that is the test. So I cannot comment on whether grout will matter because it doesn't say so in the regulation. But if it is not on a light or white background, then this would be a problem.
Okay. Thank you. Thank you. Yeah, speaking with health inspectors, it's always very black and white. So I appreciate that. Just scrolling up to a question that we did receive during the presentation. So we have an individual reaching out from Alberta. We love to see that we're crossing borders here, but they're just trying to understand more about how other provinces are managing the aquatic decks. I think, Janice, this might be in your wheelhouse to speak to.
Yeah, so I guess if we can is it Terrasu? Do you mean are they included in the supervision requirement? So generally we in the practice and facilities, if they're on the deck, we include them in our supervision requirements unless they are further than 6 feet back. Usually that means that they're actually part of a spectator area that may have a permanent barrier around it. I don't know if that's answering your question or if you had something else that you were looking at.
Yeah, maybe we can give her a moment to see if she's still on and sends us some clarification. Sherry, it's impressive that you're able to do that. So Sherry's just speaking to having to purchase a black disc and install it all while with water being in the basin.
Wow.
Yes, Tara, if you can just add a little bit more clarity to your question about the supervision of your decks out in Alberta and what you might want us to speak in detail about. We'll give you a second to type that out. Awesome. Any other questions? We have a little bit more time left. And I told Janice that if we can't fill the time, I will share a story about how she got me in trouble in my first year of lifeguarding the city of Markham. The questions are more important, so keep them coming. We'll give Tara a little bit.
I think everybody is waiting for you to tell your story. Go.
I think that's what it might be. Okay, so while everyone's obviously typing more questions, because that's what's happening here, but gosh, I don't remember the year. This must have been 2017, 2018, but I was a lifeguard and, young when you're in your teens, maybe rules don't, you feel rules don't apply to you. So I'm building a flutterboard tower. So anyone on a pool deck, 2 pull buoys, flutterboard, 2 pull buoys, flutterboard. And, we had a clock super high up and I'm like, oh, I wonder if I can really, can reach that building this. And I had pulled off the duty lifeguard because I was on rotation. Not that I should have been doing that off rotation either way. But I had asked him to help me balance the tower as I get more flutterboards and more pull buoys on. So, and who's swimming in that water at that time was Janice of all individuals, who was I think managing or directing our whole recreation department out on the west side of Markham. And so that was definitely an escalation over to my pool supervisor, let them know what was going on that morning. I think it was I don't know if there was more than 3 or 4 people in the pool at that time, but just my luck.
Yeah, but I think you need to also note that, look how far you've come now. And I think you did become a supervisor there. So I think you learned well.
There you go. So I take it everyone has one flutterboard tower in them.
Yes.
All right.
And
So
a good reason to give somebody a second chance.
there we go. And look at that timing. Okay, so they don't have, so Tara Sue doesn't have a specific question, but she was looking to get a little bit more understanding as to how Ontario is regulating everything. And I try to show up at scheduled events rather than bother people with questions. Do cross borders with Lifesaving sport, and I tend to get myself involved in the regulatory world, which we love to hear. We do have a bunch of other webinars, again, from our Lifesaving Society Ontario branch that are up on the webinar tab with Lifesaving Society. You can find us on YouTube as well. I would recommend checking those out. The standards are also a great place to start, both national and provincial, which again is the recommendations that the Lifesaving Society makes, of course, on the basis of regulations that exist. But if you don't have a specific question, then I might wrap up this webinar. We'll go in once, going twice. There we go. She says she gets her invites through holding Ontario certifications. I love to hear that. Well, thank you to our speakers, thank you to our attendees, and thank you to everyone behind the scenes getting this webinar going. If you have any questions, I will stay on this slide for just a few seconds. You're more than welcome to share your questions directly if you maybe didn't want to share it publicly. And with that, let's see, pool chemistry. Okay, we do have one thing coming up before all the thank yous flooding in. So pool chemistry in the world of following rules. Let's see. I love hearing what I am saying. Yes, Tara Sue. So thank you to everyone. Enjoy the rest of your afternoons. Enjoy the spring weather. It seems like it's finally not confused for being fall, and at least for those in the GTA. And again, we will have this webinar posted under the webinars tab. I think that's under management training or safety standards. When you go on the Lifesaving Society website, do give us a few days. And again, if we can use our React emojis here to thank our speakers. Thank you, Janice, Mahesh, and Brian for taking the time and sharing all your knowledge with us.
Thank you, everybody,
Thanks,
for
everyone.
attending.
Thank you.
Thanks, everyone. Thank you. All the best. Take care.
Take care.